Let's talk about something you've probably seen 100 times, but maybe never really thought about. That license hanging on your doctor's wall. It's actually part of a huge invisible system that's all about making sure you're in safe hands. And today, we're going to break down the actual scientific evidence that proves this whole system really works.
I mean, think about it. When you visit a doctor, how do you know you can trust them? It's a simple question, right? But the answer is pretty deep. For most of us, we just do. You see the white coat, the diploma, and you put your health, sometimes even your life, in their hands. But what is that feeling of trust really built on?
You know, for a long time, the answer was just that, trust. It was all based on reputation and this sort of general assumption that they knew what they were doing. But today, the system is built on something so much more solid. We've moved from simple faith to hard proof, and that's the evidence we're going to get into right now. So where does this proof come from? Well, it all kicks off with a series of incredibly tough exams that every single doctor in the United States has to pass before they can even think about getting their license. And this is it. This is the big gatekeeper, the United States Medical Licensing Examination, or as you'll hear it called, the USMLE. It's basically the standardized test that makes sure there's a universal baseline of knowledge and skill for every single doctor. It's like the ultimate quality control for the entire medical profession.
And this thing is not just one big test, it's a whole three-step journey. Step 1, that's all about the basic sciences, the real nitty-gritty of why medicine works. Then you've got Step 2, CK, which tests their clinical knowledge. Can they actually apply all that science to diagnose and treat people? And then finally, there's Step 3. This is the big one. Can they handle the huge responsibility of practicing medicine all by themselves with no one looking over their shoulder? It's a system designed to build and then verify their skills, layer by layer.
Okay. But this leads to the million-dollar question, right? Does doing well on a test actually mean you'll be a better doctor in the real world? For years, that was just kind of an educated guess. But now, a totally groundbreaking study finally gives us some cold, hard data. To get the answer, researchers looked at a massive amount of data. We're talking nearly 200,000 hospitalizations. This wasn't some small sample size. This was a super deep dive into real-world patient outcomes on a giant scale. So here's the breakdown of what they did. The study followed over 1,750 doctors in Pennsylvania for 3 years. And here's the really brilliant part. They connected their original USMLE scores from years, sometimes even decades earlier, to the actual health outcomes of their current patients. We're talking about real, measurable things, like patient mortality rates and how long people had to stay in the hospital. And what they found was, well, it was crystal clear. The study showed a direct link. Doctors who had scored higher on their USMLE exams had patients with lower mortality rates. Their patients also had shorter hospital stays. This is it. This is the proof. It's not just about passing a test. That score is a measurable predictor of better care for patients. Of course, the organization behind the exam itself had something to say. Dr. Alex Meccabayer from the USMLE said that this research confirms exactly what the test was made for, to make sure doctors have the essential skills to give safe and effective care. It's not just a theory anymore, it's a conclusion that's backed by a ton of data.
So let's zoom out a bit. What does all this mean for the bigger picture? Well, this study does way more than just prove one test is useful. It basically validates the entire reason we have medical licensing in the first place. So the next time you hear about those grueling board exams that medical students have to go through, remember this. They aren't just random academic hoops to jump through. This research proves these exams are testing real, life-saving skills, the core abilities that are absolutely essential when someone's health is on the line. It's a critical part of our public safety net.
And this whole idea of scientifically proving that doctors are competent, it's not just a priority in the US, it's a global thing. Health organizations all over the world are tackling the exact same challenge. How do we make sure our medical professionals are truly qualified?
In fact, just recently, the World Health Organization, the WHO, released its first ever global guide on this very topic. It's a huge signal that there's a worldwide agreement that having a strong, evidence-based system for regulating health workers is absolutely critical for public health.
Jim Campbell, a director at the WHO, pointed to the compelling evidence of the added value that this kind of regulation brings. So, in other words, these systems don't just protect patients, they actively make the entire health system better and help build a stronger, more capable medical workforce for the future.
And just look at all the good things that come from this. I mean, patient safety is number one, obviously. But a strong regulatory system also makes sure doctors practice ethically, it helps medical schools improve how they teach, and it even helps plan for how many doctors we'll need in the future. At the end of the day, it strengthens the entire healthcare foundation of a country. It's a really powerful tool.
So after all this data, all this global policy, let's bring it right back to you. Why does this complex system of testing and licensing actually matter in your day-to-day life?
Well, because that trust you feel when you walk into a doctor's office. It isn't just a gut feeling. It's built on this invisible foundation of proof. It's the hard evidence that your doctor didn't just go to med school, but that they also prove they have a high level of skill on an exam that we now know is directly tied to better care and safer outcomes for patients, for people just like you.
And that leaves us with one last really important question for the future. We've seen how valuable our current system is, but medicine is changing at lightning speed with things like AI and new technology. So the question is, how do these gatekeepers, the exams, the licenses, the regulations, how do they have to evolve to make sure our trust is just as solid for generations to come? Thanks for tuning in.